This is Samna, optometrist from Global College of Allied Health, Natalam. Today, we are going to discuss about the topic low vision aids. Definition: a person with low vision is one has the impairment of visual functioning even after treatment and or standard refractive correction and has a visual acuity of less than 6 by 18 to light perception or a visual field of less than 10 degrees from the point of fixation, but who uses or is potentially able to use vision for the planning and or exertion of the task. WHO definition: a person with low vision is one who suffers visual acuity between 6 by 18 to 3 by 60 in the better eye after the possible correction, or a visual field of vision is between 20 to 30 degrees. The visual dysfunction is again classified under the four categories: the visual disorder, visual impairment, visual disability, and visually handicapped. First one is visual disorder, that is the deviation from the normal visual structure by a disease, injury, or anomaly affecting the vision. The second one is visual impairment, reduction of visual function result from a visual disorder. Visual disability, reduced ability to perform a certain task. Visually handicapped, non-performance of the task later to individual and social expectation because of visual disability. These are the categories of low vision aids. 6 by 6 to 6 by 18 is considered as normal. Less than 6 by 18 to 6 by 60 is under low vision, and less than 6 by 60 to 3 by 60 is considered as a low vision. Less than 3 by 60 to 1 by 60 is under low vision. Less than 1 by 60 to PL is under low vision. No PL is considered as a blind and it is a total blindness. Low vision aids: an optical or non-optical device that improves or enhances residual vision by magnifying the image of the object at the retinal level. The principle of low vision aids: optical low vision aids are based on the fact that with sufficient magnification, the normal retina surrounding the damaged central retina can be used for central vision. There are two types of magnifications for low vision patient. The first one is relative size magnification. The second one is relative distance magnification. Relative size means by making the object bigger, that is, example CCTV, no accommodation is required in this relative sized magnification. The next one is relative distance magnification. It is obtained by bringing the object closer to the patient. That is, it requires good accommodation. The indication of low vision aids in children's: albinism, retinopathy of prematurity, congenital malformation, optic neuropathy, and in young adults, keratoconus, ocular injuries, late manifestation of congenital malformation. In old age, glaucoma, age-related macular degeneration, diabetic maculopathy, macular degeneration, retinal degeneration, chorioretinitis, optic atrophy, and myopic degeneration. Types of low vision aids. There are two types of magnifications. Optical devices and non-optical devices are given as a magnifying substance for the low vision aids patients. The optical low vision aids are magnifying spectacles, hand magnifiers, stand magnifiers, telescopes, intraocular low vision aids, and other optical devices. The non-optical devices are approach magnification, lighting, contrast enhancement, increased size object, electronic magnifiers such as CCTV, LBIS, PMAS, writing and communication devices, orientation and mobility illusion aids. These are the magnifying spectacles of plus power. Magnifying spectacles. High plus lenses is used to magnify the images. The magnification is 1 by 4 the power of the lenses. It is suitable for near and intermediate distance. It may be monocular or binocular. Advantages of magnifying spectacles. These are hands free. Field of view is larger when compared to the telescope. Simultaneous near and intermediate vision can be given in both monocular and binocular forms. It is more portable, cosmetically acceptable. Disadvantages of magnifying spectacles causes spherical aberrations. Higher the power, closer the reading distance. Close reading distance cause fatigue and unacceptable posture. Patients with eccentric fixations are unable to fix through these glasses. Illumination problem. The next one is hand magnifiers. These are indicated for spot and short time tasks in patients with the field of vision is reduced to 10 or more. These are available from plus 4 to plus 40 diopter and in three designs: aspheric, aplanatic, and biaspheric. The advantages: the walking distance is more, accommodation is not required, easy to manipulate for weaving eccentrically. Some have light source, which further enhances vision. The disadvantages are it occupies both the hands, not useful in absence of manual dexterity. Field of vision is limited, need to be held at the correct distance. The next one is stand magnifier. It forms a visual image a short distance behind the lens. The patient needs to place the stand magnifier on the reading materials and move across the page to read, and it has a fixed focus. Advantages: these are technically simple. They are a choice for patients with traumas, arthritis, and constricted visual fields. Disadvantages are small field of vision, too close reading posture, which is uncomfortable for the patient, difficult to use if the surface is not flat. Telescopes. These are used to magnify the distance object. They work on the principle of angular magnification. Telescopes with magnification powers from 2x to 10x are prescribed. There are two types of telescopes: Galilean telescopes and Keplerian telescopes. The advantages: best possible low vision aids to enhance distance vision. Disadvantages are restriction of the field of view, Depth perception is distorted, loss of light transmission, expensive and costly. The other optical devices, the absorptive lenses or tinted lenses, photochromatic lenses, filters, polarization lenses, Corning CPF filters. The visual field enhancement devices are Fresnel prism, hemianopic mirrors or spectacles. Approach magnification. Partially sighted patients should be encouraged to move as close as possible to the object. The next one is illumination. Illumination, positioning of illumination to the side of the better eye, moving the light closer. The high levels of illumination is required for the patients with the macular degeneration, glaucoma, diabetic retinopathy, retinitis pigmentosa, and chorioretinitis. Reduced illumination is required for the patients with albinism and aniridia. Contrast enhancement is attained using a typoscope's contrast modifications of visual environment. Relative size devices. These are large printed material, enlarged clocks and telephones, calendars, computer keyboards, large type playing cards. The electronic magnifiers are closed circuit television, CCTV, low vision imaging systems, and VMAX. Writing and communication devices are writing guides, signature guides, check guides, notex, tactile or raised line papers. The mobility assisting devices or patients with a low vision suffers a major problems of mobility using long canes and strong portable lights as a mobility assisting devices. The evaluation of low vision. First one is street taking, checking visual acuity, checking for color vision, visual field analysis, glare and contrast sensitivity, and look for the dominant eye. The prescribing low vision aids. A. Simple, lightweight, portable, and flexible. Patient's visual and mental status, needs, and motivation. The working distance and the field of vision is decreased with the increased magnifications. All the devices should be tried. Both the eyes should be corrected. The careful consideration of children's old age and single-eyed persons. The electronic devices are video magnifiers, closed circuit television, and video eye. Hemianopia uses Fresnel prisms, reflecting mirrors, and spectacles. This is the hemianopic spectacle used in low vision aids. The non-optical devices are bold prints for computer keys, telephone dials, insulin syringes, and calculators. The low vision software or JAWS software, speech output software. The video augmented vision, use of tiny spectacle mounted video cameras and displays to mitigate the loss of peripheral vision. A wide field unified image can be overlaid on the Normal view seen through one or both the spectacle lenses. Video augmented spectacles to aid the night vision, experimenting with the video cameras that operate in very low light conditions. Ocular diseases and low vision aids. Macular degeneration. This is the fundus image of macular degeneration, and this is a field of view in macular degeneration. This central vision is diminished in age later macular degenerations, and the peripheral vision is retained. Macula in the retina degenerates. Area of is affected is macular region. Visual effect is fuzzy and decreased vision, metamorphopsia, poor central vision, photophobia, poor color perception, better vision at night. Low vision aid you should prescribe is good lighting, use of strong color contrast, magnifiers, non-optical devices, and visual rehabilitation. This is a fundus image of age-related macular degeneration. Diabetic retinopathy. Break, breakage of retinal blood vessels and leaks in this condition. People with long-standing diabetes cause diabetic retinopathy. Area affected is retina. The visual affectors decreased visual acuity, fluctuating visions, loss of color vision and visual field, inability to accommodate, and floaters. Low vision aids we should prescribe as various illuminators, work under direct sunlight, and visual rehabilitation. This is the fundus image of retinopathy, and vision in retinopathy looks like this. Next condition is retinitis pigmentosa. This is a retinal pigmentary degeneration. Rods of the retina are slowly destroyed. Retina is the area affected in this condition. Visual effects of decreased visual acuity, difficulty in night vision, loss of peripheral field of vision, photophobia, poor contrast sensitivity, difficulty to adapt in changing illumination. The low vision aids should prescribe or optical aids such as telescopes, night scopes, Fresnel prisms, visual field expanders, use of filters, high contrast letters, and rehabilitation. The retinitis pigmentosa fundus image will be look like this, and this is an image of visual field in retinitis pigmentosa. The peripheral vision is diminished, and central vision remains better, a bit better than the peripheral vision. Next condition is glaucoma. The aqueous humor does not drain normally, and excessive pressure is pulled within the eye, resulting in damage of optic nerve. Optic nerve is the area affected in this glaucoma. Visual effect is gradual blurring of vision, halos around the light, reduced peripheral vision, and photophobia. The low vision aid should prescribe or magnifiers depending upon the extent of visual field, CCTV, CPF lens to reduce glare, and prism. This is an fundus image of glaucoma patients, and this is the visual acuity in glaucoma patient. That is, peripheral vision is diminished in glaucoma. The next condition is cataract, that is opacification of the lens causing less amount of light into the retina. The vision becomes hazy and inconsistent. Crystalline lens is the area affected in this condition. The visual effects are blurred vision, glare, that is difficulty in bright light, diplopia, normal visual field, sometimes reduction in the side vision, squinting, and amblyopia. The low vision aid should prescribe or close work, use direct light, use sunglasses to avoid glare, stand magnifiers for near work, filters such as amber and red brown filters. The next is retinal detachment. Retina is separated from its supporting structures and receives no nourishment. The blind area develops in the area of detachment. Area of is affected in this condition is retina. The visual affects is flashes and floaters. Visual acuity is reduced. Micropsia. Color vision is impaired. Loss of visual field. Photopsia and glare. We should prescribe the low vision aids such as high illuminations, filters, CPF lenses, magnifications for both near and distance, and non optical aids. Albinism, total or partial loss of pigments in the eye. It is characterized by the light colored iris and eyebrows. Area affected is retina and macula. Visual affect is decreased visual acuity. Distance vision is more affected than the near vision. Painful photophobia. Field of vision is normal. The color vision is also normal. Low vision aids should prescribe as such as dim illumination, dense sunglasses, absorptive lenses, telescope for distance vision, colored or pinhole type contact lenses. This is the albinism patient. The functional effects of low visions is peripheral field of loss, central field of loss, and overall blurriness. The behavior implications. In the loss of central vision, such as macular degenerations, toxoplasma, scar, etc., it causes difficulty in reading, problems in writing and completing the paperwork, inability to recognize distant objects and faces. In the case of peripheral vision loss, such as retinitis pigmentosa and glaucoma, the patient has difficulty in mobility and navigations, difficulty in reading if there is a constricted visual field. Visual acuity may not be affected until very advanced diseases. The third one is cloudy media. It causes that is due to the corneal scar, vitreous, hemorrhage, etc. It causes blurred vision, reduced contrast sensitivity, and the problems with the glare. Should consider the patient's detailed history, that is such as occupations, living situation, general health, other limitations, family history, previous low vision care. Difficulty in visual task, that is doing the near visual task, computer usage, light sensitivity, mobility issues, and if any, ADL. The visual field assessment is important for the low vision patients. First one is using Amsler grid to assess the central visual field, absolute scotoma, relative scotoma, and metamorphopsia. Confrontation test assess the peripheral visual field checked in all four quadrants, and it is usually quick and basic technique. Thank you.